Welcome all, and thank you for attending the series of webinars which we are starting at the moment in terms of looking at transitioning and commissioning of the mental health accommodations that we have in ED. And at the moment, as people are aware, we are talking about behavioral assessment unit that would be open. At the moment, we've got a tentative date of opening that on 22nd of June, and these series of webinars are around some of the, topics and some of the changes that would be brought through in ED as part of these accommodations happening. So today's topic is really focusing on the mental health and AOD patient streaming and arriving the patient and the assessment locations as we are expanding our footprint. Obviously, there are some challenges with working in a large ED with multiple different sort of craft groups working together. So I've got here with us Mark Dent, who most of you would know is our Deputy Director of Emergency Department, who would be going through a presentation around the model of care that we are putting and how that would be impacting the streaming. Along the panel, I have Kylie Roper, Operations Manager for Emergency Services, and Gary Ayton, Director of Sunshine ED, and Chris Blatt from our AOD services as well. And the panel would be here to provide any answers. Please use the Q&A function or the chat function to provide any questions as you have, and we'll try and sort of address them at the end after the presentation. Thank you. I might just hand over to Mark.
Thanks, Deb. Welcome, everyone. I'm going to share with you a PowerPoint presentation that will just run through the streaming of patients with mental health and drug and alcohol issues into the department. So let me just... So, as you all know, and as Dev's just alluded to, we will be opening the BAU in June. And this is looking at the streaming of those patients through those areas. Just as an overview, the BAU and the hub as a model, it's there to support integrated, multidisciplinary and holistic care for patients who present to Sunshine ED with mental health or AOD concerns. You can see there in that graphic that the patient is essentially at the centre of that process with expanding circles out for each of those areas. The teams that will be involved in looking after the patients in those areas, the BAU team will be responsible for providing care to patients eligible to go into there, and will be made up of medical nursing, clinicians, EMH, addiction medicine, and ACE. The hub will be responsible for providing care to patients who are eligible to go into there, and it will be essentially nursing-led with medical support available from the main department in terms of the ED physicians, but it will also be made up of clinicians from EMH, addiction medicine, and the ACE teams. So overall, as the patient arrives, obviously they will attend to triage and be registered, and at that point, the streaming process can occur. They will also obviously end up waiting to get to one of those points of care. Following that, we're providing care, we're planning, assessing and treating those patients, and as a further step towards that, it's their disposition, whether they are going to be discharged to the community or admitted into hospital. So the patient journey map is outlined there, just showing those different steps and showing the different parts within the department with the additional areas that will be opening up, including the hub and the BAU, which are in addition to the areas that we already have in place now following our expansion. So streaming, which is the topic for today, streaming essentially is to all those patients who arrive to Sunshine ED are triaged on arrival, and essentially that's to determine their acuity and care needs. And following that, we stream them into the different areas of the department, which are designated pods. And the streaming process is to recognise those individual care needs and to select the most appropriate team to deliver the right care to the right patient at the right time. So who can stream? At this point, we have the triage nurses that presenting or the person that they present to initially, and other points of streaming can occur from the ED nurse in charge of the shift or the consultant in charge of the shift, or pod leaders, be they nursing or medical, be they EMH clinicians or the mental health nurse navigator. It's a handful. So streaming points, just going back and with regard to those people who can stream, so it will occur at triage, and we identify patients there who do need either mental health or AOD input, and front end stream them to the most appropriate area. So in that space, the assessment areas being the TAR rooms, or with regard to ambulance arrivals at the AB corridor, but streaming can also occur from the ED cubicles within the main department. The areas that we're streaming to, so the designated mental health and AOD accommodation will be the BAU and hub, and that will be to provide care to the patients between the ages of 18 and 64 who present with needs in those areas. So admission to the BAU or the hub might occur post-arrival to the department after an individual has received acute care for their physical health. In some cases, patients may need to wait for admission into those areas. And obviously that initial intake and assessment and intake will focus on reducing the risk associated with the wait. Exemptions to the age criteria can occur, but will be approved by the ED consultant or senior medical officer in charge overnight. Patients who aren't eligible for those areas currently.
Any seniors or triage competent staff wanting some overtime for the night duty, let Maddie know, please.
Sorry. So non-eligible patients are those under 18. They will be admitted to the children's area, and upon referral may be seen by EMH and AOD. And those patients over 65 who will be streamed into an ED cubicle and will be assessed following review by medical staff, who then refer on to mental health or AOD. So patients with acute behavioural disturbance, their streaming process is to facilitate de-escalation via a plan code grey and transfer to the bar room. And essentially at this point in time, that process occurs by streaming, usually via the AV corridor, to the BOC room, de-escalating that patient and having them transferred through to an appropriate area following that. So the process following, well, as BAU opens, will be to move to the bar room and do that de-escalation there. And from there, to determine that appropriate destination based on that assessment, whether that will be the BAU or the ED cubicle or even the hub. Patients presenting with presenting in behavioural crisis with mental health and AOD needs, if their BOC is greater than or equal to 1, they will go to the bar room. If they're acutely unwell with AOD issues, they will go either to the BAU or an ED cubicle. And if they're medically unwell, they will go to an ED cubicle or resus. Low acuity patients with mental health and AOD issues or low acuity psychosocial issues, so those patients with a BOC score less or BOC score of 0, who are medically stable and who have no acute suicidal ideation or behaviour, can be transferred to a TAR room or the BAU interview room for assessment, and then subsequently can be transferred to the BAU if they need it, but more likely to an ED cubicle or the hub. So the flow schematic there shows that process on the left-hand side of triage, and those patients who have either acute behavioural disturbance at the top, or those that are acutely unwell in that middle section, and those following those, the acutely unwell with mental health and AOD issues, but with a BOC less than 1. Following down to those with mental health issues, and then those with lower acuity problems. So they can be streamed through, depending on the risk factors, into the appropriate areas as we progress through that to the right. When there are access issues, so if there's no hub bed, then that patient will go to an ED cubicle or to a resus bed, depending on their needs. If there was no bar room available, that patient would then go to resus, and following a process there, a de-escalation and management would then probably come out and go to an ED cubicle. If there was no BAU bed, they would go into resus and then eventually step down to an ED cubicle. And if we have no BAU interview room, they could be admitted directly into BAU and then to an ED cubicle following treatment there, or potentially may go direct to an ED cubicle in the first instance. So that's essentially streaming in a nutshell. We're happy to take questions from there.
Thanks, Mark. Yep. And just to highlight that the last slide that was shown there was around just a guideline. And again, just reflective of processes that currently happen. And obviously the clinical decision by the clinical leaders who are on the side, there's the nurse in charge and the emergency physicians. Probably, there is that clinical discretion around how they manage their department. Just for everyone to be clear that we are not saying this is set in stone. It's just a bit of a guide because these are new areas. So just to probably avoid some confusion. Thanks, Mark. That was a great presentation. I'm just wanting to check with the attendees or panel members if there are any questions for Mark or anyone. You have to answer chat function as well as the Q&A function. I haven't seen any questions pop up yet, but I'm happy if there are any questions coming. Hopefully this was a clear view of things. All right. No questions. I'll give another minute. Otherwise, we can close the webinar unless anyone else has anything to add here.
Dev, there is a question in there. Can a registrar stream?
Do they stream now? If the answer is yes, then they can stream. So again, we are saying that medical leads who generally are streaming currently patients, they can definitely stream patients. Sorry, I'm not able to look at the Q&A, so maybe there's an issue here. So happy if there are any other questions that are there that we can answer.
Just to expand on that, certainly overnight they would be streaming, when there's no consultant in charge in the department.
All right. Oh, no, there's a question then. Pharmacy involvement with the hub. Yes, I think there was a question that is there in the chat. I'll just read it out and I'll probably ask Gary and Mark to probably answer that. How do you all expect much pharmacy involvement with the hub, including impressed medications? So Gary or Mark, do you want to take that?
Yeah, I can take that one. My understanding is there will be a need for some medications in the hub, and my understanding is that will probably be resourced from the fast track medication room, I think.
And we do have a dedicated medication room present in the hub as well. So we'll probably be working through that. At the moment, we are opening the BAU, so we're all focusing on the BAU medication impress list, but we'll probably be in due course working on that as well. So thanks for that question. Any other questions? Yeah, so I don't think that any questions have popped up yet. So Mark, thanks for that presentation. And this presentation would be, oh, sorry. This presentation obviously would be available for viewing soon on the United microsite. As part of the sign off, I just also wanted to flag that there are 3 more webinars about the BAU and the hub, followed by a 4th webinar around distraction calming strategies. That would be a webinar that we had already recorded that will be available for staff to see. So yeah, please tune into those webinars, and please let us know if you've got any queries or questions, and we're happy to answer them as much as we can. And thanks for your ongoing support and involvement in making sure that we are able to open the mental health and AOD accommodations as we progress through that. Thank you all. See you.